Hello everyone, I am Dr. Manju Dagar, Senior Consultant IVF Specialist, Nestling Hospitals, Nestling Gynecology and Fertility Clinic. Today I am going to speak on coronavirus in pregnancy. So in day-to-day practice, we have seen there are a lot of queries coming from the pregnant ladies, how to protect themselves from coronavirus. So we thought let's discuss on Facebook so that a lot of patients will get help from this information. So there are a lot of queries and a lot of fear, lot of questions in pregnant ladies' mind, like how I prevent myself from exposing to coronavirus patient, how I get to know that I'm suffering from coronavirus, how I prevent myself. If I got coronavirus infection in pregnancy, then what happened to my baby? Is it transmit to my baby? Is it affect to my pregnancy? Is there any complication? Do I breastfeed my baby during coronavirus infection? So there are a lot of fear in the going in the minds of the pregnant lady. Let's clear one by one. So these are the questions that we have noticed from our day-to-day clinical practice that are coming from our pregnant patients. So if you have any query in your mind, you can ask, and I'm happy to answer all the queries. So first, what are the symptoms of coronavirus? How you get to know that you are infected with the coronavirus? One is fever, that is the most important. Second is you have cough. Third is body aches, malaise. These are some symptoms that you get. Cough is a very unusual cough, different from other cough. Like when you have continuous coughing, this is a dry cough. Then you get to check yourself for the coronavirus. Is there any exposure to the coronavirus positive patient? If you know, then you isolate yourself, notice your symptom daily. If you find these symptoms in yourself, please get tested for it. If you don't have any symptoms, then please don't panic. Stay home, keep yourself in isolation. It will tell you your status with time. Second is if how I protect myself in this scenario. We all knows day to day in media, in television, in news that coronavirus is spreading rapidly all over the world. WHO already declared is a pandemic. So yes, there is a very scary environment, but no need to be scared. Just you take few precautions, like don't go to the crowded places, avoid all traveling, do frequent hand washing with the soap and water at least for 20 seconds. Remember, at least for 20 seconds. If you are not able to count for 20 seconds, just say happy birthday to you 2 times, it will give you 20 seconds. Or you can count A, B, C, D to till Z, give you 20 seconds. So second is if there are some places that you won't find any soap and water, then keep some alcohol based sanitizer in your purse. You can sanitize your hand. Second is like I already told you, don't allow any friend or any person who is having that cough, fever, suffering from any of these ailments. Avoid to going unnecessarily meeting in the hospitals. And if you are a pregnant ladies and your company is allowing work from home, then you can adopt that also. Fourth is keep yourself well hydrated. Take adequate rest so that your immune system will be healthy and your body will fight with the infection in a better way. Next is if I get infection in pregnancy, then what I do? Now my next query is it affect my baby? Yes, that depends in what stage of your pregnancy is when you are getting the coronavirus infection. Some ladies are fear of like some virus infection can lead to malformation in baby. Till now, there is no report that is giving us that there is any malformation with this virus in the pregnancy in baby. But nowadays, this is the recent viral infection. There are limited knowledge about it. There is limited research about it. But till now, the data is saying there is no risk of malformation to your baby. There is no risk of transmission to your baby. In China, Wuhan city, in Johnson Hospital, there are 9 patients delivered uh, during that period in January of the coronavirus spread. Out of the 9 pregnant ladies, only one newborn they find it infected with the coronavirus. One newborn only. 8 are not infected with the coronavirus. And during this infection, all tests are done for the newborn also, and for the amniotic fluid, that the fluid that surrounds the baby, all find negative. There is no virus found in those samples. So it is very unlikely that during pregnancy coronavirus goes to the baby, but it can spread to the baby even after delivery or during delivery. In 9 patients, all patients underwent a cesarean section. Only one baby found to be positive. That can be after the exposure to the pregnant lady. All are positive, coronavirus positive. And then can be during the delivery. So the research, we are waiting for the research for the new thing, but presently don't to be panic. There is no virus in amniotic fluid in these ladies.
Ma'am, what can I do to protect myself from coronavirus if I'm pregnant?
What can I do to protect myself if I'm pregnant? To protect my just the pregnant ladies are not at higher risk of getting the infection from the coronavirus. They are as vulnerable as the general public. So no need to be panic. Just adopt all precautions as the general public is taking. As our health ministry is saying that बार-बार अपने हाथ धो लें साबुन से और पानी से. जितनी बार भी आप किसी के कांटेक्ट में आए, वॉश योर हैंड. जब भी आप किसी वॉक पे जाएं, वॉश योर हैंड विद सोप एंड वाटर. यूज हैंड सैनिटाइजर. डोंट शेक योर हैंड. डोंट कम to anyone. Keep a distance, social distancing at least 3 feet. For this prevention, you need to know how this virus spread. This virus is spread by the airborne droplets. When somebody sneeze or cough, that air droplets comes into the air that is around you. If you keep a distance of 3 feet, that air droplets settle down, will not come to you. And or the virus is when these droplets settle down on some surface, they survive for 12 to 24 hours. When you touch that surface, that leads to infection. So if you take all information or all precautions of hand washing and not touching your face, your eyes, your nose, your mouth with the hand without washing, that will prevent you from getting infection during pregnancy.
But if my wife is not getting a hand sanitizer, then can we use a simple soap?
Simple soap and water is the best solution for it. But sometimes we are in a place that sometimes water and soap is not available. Then only hand sanitizer will help you. Otherwise, soap and water is the best solution for it.
Ma'am, will my baby will be tested for coronavirus?
If a pregnant lady is positive for the coronavirus, she is a confirmed case of coronavirus, at the time of delivery, yes, baby will be tested for the coronavirus status, whether it is positive or negative. Definitely will do check. If you are negative, if you are suspected case, then we check your symptom first and we can check the baby later on.
Ma'am, if we are not getting the face mask, like these are not available, like some are telling that N95 is safe and we are not getting safe face mask, then how can we protect by simple measures?
See, face mask is not for everyone. Face mask is for the health workers and for the people who are already suffering from coronavirus or some cough or cold. Only for them they are helpful. They are not helpful to you. You just keep a distance of 3 feet and you just avoid social gathering and use hand wash and normal hygiene practice. Whatever I told you, you will get prevented by this. Face mask is not necessary for the general public. Yes, for the health worker, for the doctors, for the staff nurses, whosoever taking care of the coronavirus positive patient, they should use it and discard it properly.
Ma'am, if I'm pregnant, what is the risk of miscarriage?
Till now, the data is limited, research is limited, our knowledge is limited. But till now, whatever the knowledge we have, the coronavirus will not affect the miscarriages and malformation in the baby.
Ma'am, if I get sick with coronavirus, what is the risk of passing the virus to my fetus or my newborn?
There are limited patients, only 9 to 14 pregnancy of coronavirus positive cases delivered. In those cases, I already told you, There was no infection in the newborn. There was no infection in the fluid around the baby. There was no infection coronavirus found in the breast milk. So there is no risk to the baby presently. But still, we need to take all precautions, and it will not. The vertical transmission is negligible presently up to our knowledge.
That is, there is a lot of news that the rising temperature is going to reduce the frequency of the virus.
Yes, that trend we need to see. That trend we need to see. It can prevent or not. A lot of research is going on. Can't say about it right now.
Ma'am, suppose that I have been detected or suspected to be a coronavirus case. So, will I be able to allow to stay with my baby?
If you are a coronavirus positive case and if you want to stay with your baby, it's totally your decision. But we can advise you, if you are corona positive patient, then you need to stay from your baby. But it's a very harsh decision to take because it affects your bonding and feeding. And but in China, in Wuhan, the whosoever lady is pregnant and delivered with the coronavirus positive cases, in Wuhan hospital they keep the baby in isolation for 14 days from the mother.
It was lovely talking to you, ma'am. Thank you for
And
it.
in breastfeeding, there are a lot of questions also. कि अब हम ब्रेस्ट फीडिंग करा सकते हैं कि नहीं करा सकते हैं ड्यूरिंग आर कोरोना वायरस पॉजिटिव सिचुएशन. You can do breastfeeding. Breastfeeding outweighs various risks, various diseases, various infection. Breast milk is the most nutritious milk for the baby. We cannot say you to avoid this, but along with the pediatrician, situation of the patient and situation of the baby, we can decide whether to go ahead with the breastfeeding or not. As such, breast milk, we don't found any virus, but during breastfeeding, there are a lot of precautions you need to take. Like you need to touch your baby after washing your hand, use face mask, you wash your nipple, and whenever you feed your baby, you don't cough, you don't sneeze over the baby, just move your neck to the side, and you take all precautions for this. And after that, or if you are expressing the breast milk, you give to the breast milk to the lady who is coronavirus negative to feed your baby. So these are the precautions if you want to breastfeed your baby and if you are healthy and there is no severity.
Ma'am, a case was found in China that a newborn baby was having coronavirus who recovered after 17th day. What are the chances of recovery?
Chances of recovery in newborn is good, but the chances of recovery in elderly and in pregnant women, and a diabetic patient or already compromised respiratory system like asthmatic patient, bronchitis patient, the chances are bad. Otherwise, a healthy newborn, if catch an infection, the chances are good. But as I told you, the data is very limited, knowledge is very limited, research is going on, we'll be able to answer properly in future. So there are some ladies also asking, like I'm IVF specialist, some ladies are also asking for the IVF program, for the planning of the pregnancy. Presently our societies, Asian, European Society of Reproductive Medicine, American Society of Reproductive Medicine, Royal College, all are recommending that please postpone your pregnancy planning until unless there is an emergency. Like if anyone is suffering from some disease or any urgency, then only we can go ahead, or someone who is already in the program, in IVF program, we can complete the program, but we need to freeze the embryo, we need to freeze the oocyte. Please avoid embryo transfer, whether it is fresh or it is a frozen. Because we are telling you, in pregnancy, infection rate is same with the general public. But problem is in pregnancy, there is a fetus inside also. We need to select the medicine, and there are some medicines that can't be advisable in the pregnancy. So we are restricted, and that impact your baby health also. And during treatment, you get exposure to the hospital, to the clinics. So avoid planning all elective procedure or elective pregnancies, all elective surgeries, or all diagnostic procedure during this outbreak. Let's see will the next 10 to 15 days will sort out and will give the clear picture. After that we can plan further. If you want to ask any further questions, I'm happy to answer. Thanks.
Thank you.
We can update
Thank you.